This is a PowerPoint to familiarize you with some of the timelines regarding special education, the important meetings that take place, and to get you ready for the IEP timeline assignment. This is the first slide. It's just a schematic to show you uh, that the process of getting a child eligible for special ed is a multidisciplinary one, and that if a child does not qualify for special education, notice that we need to get back to the student assistance team for ideas on what to do to help the child outside of special education. Remember that the student assistance team is a general education body, and that it is not a place where we just refer kids for testing for special ed. It's a place where we try out some important interventions, see how they work. We might want to try one out for 6 weeks, come back in 6 weeks, see how it's doing. We might need to tweak it for another 6 weeks or try a different one. But unless it's a serious, severe disability that we're dealing with, certainly not a learning disability, we do want to use general ed to its fullest before testing for special education. And we also want to make sure that the parents are aware all along through this process how their children are doing. We don't want a parent to be surprised at all during this process. And while it is not a legal requirement for parents to attend the student assistance team meeting, it is a good practice to involve the parent in it. We don't need to document contacts for this, but again, it's a good practice to have the parents involved. And we certainly want to make sure the parents know that the child is struggling before we even have any meeting. Make sure you've gone through the records of the child, the CUME file. You know, you'd be surprised what you'd find in there. Sometimes in my career, I found already existing special ed paperwork that was just misplaced in a CUME file. Find out about the history of the child, what worked well with the child in previous years, what hasn't worked well. Begin to document what you've tried with the child before referring the child. Remember that we want to try things first before using our general ed body, the student assistance team. We certainly want to try interventions prior to testing for special education. Remember that that the student assistant team is a general ed body that supports the general education program. And who's on this team? Well, a representative of general education, an administrator that can divvy out resources when appropriate, a special ed person as a consultant, perhaps a school psychologist, perhaps a school counselor, school nurse. These people can be on the student assistance team. We certainly want to have good a form available in the school for referring people to the student assistance team. Again, this is not special education paperwork. This is general education paperwork, but a good practice. Uh, Before we test a kid for special education, we want to use general ed to its fullest. Try out a few interventions. Remember that in Nebraska, as in the federal law, once an assessment plan has been requested by a parent or a school personnel we have 15 days to respond. We don't necessarily have to agree to test the child as long as we can document and show that, testing is not indicated, that the child is fairly close to grade level. 10 days is considered reasonable notice of meetings. We do not need reasonable notice for student assistant team meetings, but for the MDT and for the IEP, we do need 10 days of notice. The IEP must be held within 60 days after an assessment plan has been signed by the parent. In Nebraska, it must be held within 45 days. We are faster than the law in Nebraska. Remember that all of the activities that take place take place in these various stages: before the student assistance team meeting, during the student assistance team meeting, prior to the MDT, during the MDT, and then prior to the IEP, during the IEP, and after the IEP. And keep in mind that some of this is common sense. Like, for example, we need to send parents' rights brochures out prior to the MDT and prior to the IEP. In some situations, the MDT and the IEP will be held on the same day. But the MDT responsibility is just to decide that the child is eligible and what their category of disability is. All of the services that are going to be provided are decided during the IEP. Now, take a look at your IEP timeline assignment and place the activities where they belong under each category.